All right. Good morning, everyone. Welcome to the December meeting of the Brooklyn Developmental Disabilities Council. Hope everyone is doing well and ready for the holidays, only a week away. Just start off, kind of reminder, please be respectful of presenters and speakers. Stay on mute if you're not speaking or presenting. Use the hand raise option if you have a question or want to give an announcement when we do later in the meeting. And if there's a personal or specific issue related to you or a child of yours, please reach out to us. You can do private messages or email any of us. You probably want to have that conversation on the side versus in front of everyone in the meeting, and we're more than willing to help you or help you get in touch with the appropriate party. So today we have a special presentation later in the agenda by Suzanne McDermott on the Steps to Cuny program. I know she's made an announcement on that a few times at our previous meetings. And anything I'm missing before we get into some council updates? Okay. So regarding the Brooklyn Council, some good news. We finally have chair people for our employment committee and our legislative committee, and both of those committees will be restarting in January. So if you take a look, I think the dates are set for the employment committee. They're on our website, bkddcouncil.org. And I know they're working on setting the dates for the legislative committee, but both of those committees will be starting in January. So the only committee, if anyone is interested, that we're still looking for volunteers to co-chair is the Residential and Housing Committee. So again, if you're interested, please feel free to reach out to myself, Rochelle, or Marjorie, and we can set up a meeting and discuss more about it. The five boroughs are planning on doing the virtual legislative breakfast again. It's been a success the last couple of years. As of right now, the date that we have set is Friday, March 1st at 10 a.m. So please put that in your calendars and hold the date. So again, the plan for this year is to continue with the virtual five-borough legislative breakfast. And the date as of right now is March 1st at 10 a.m. As we have more information, we will definitely send it out. OPW is hosting managed care surveys. Those are due by January 3rd. There is two different surveys. One's for providers and one is for families and people supported. I will share the links on our website after the meeting. I will share the email out. I will put the links in the chat, but please make sure it's important for them to gather data and get your feedback on managed care. So again, those are due by January 3rd. So you still have a couple of weeks. And then also tomorrow, the 19th, there's an assembly hearing to examine the status of the healthcare workforce in New York State at Hunter College at 10 a.m. And again, I will share out the notice in the chat, and also I can put it on our website and email it out if I didn't already. But the notice states if you can't make it, that the meeting will be recorded. So again, this is tomorrow at Hunter College at 10 a.m., an assembly hearing to examine the status of the healthcare workforce in New York State. So with that, I don't think Brooklyn has any more updates, so I will pass it off to OPW. And I know we have Nina here, so thank you for joining us, Nina, and the floor is yours.
Good morning, good morning. I'm going to start with the updates about the strategic planning. So OPWDD recently finalized our 2023 annual report, which we plan to release this winter. The plan will be shared on our website, and we will include a plan language and translated versions. This report will be a unique opportunity to update the public on many different projects that we work on and in various initiatives and that we were focused over the last year. This report is framed around the strategic plan and goals, and it includes the updates and progress we've made in 2023. And it will include the updates on key projects related to growing and strengthening our workforce and updating our system to better meet the needs of the people we serve. This report will also include an overview of our recent stakeholder engagement activities and a summary of the feedback shared with at those events. And this information that we'll be sharing is an important part of our ongoing commitment to improving transparency and creating more opportunities for communication and collaboration with the people we support, with their families, agencies, and various stakeholders across the state, in sharing the progress, both our successes and also the struggles. We aim to create more accountability, both to our colleagues and the public, as we strive to improve the systems that we oversee. So stay tuned, and I'm really looking forward to see that report as well. I will give you a couple. I think I mentioned in our last meeting, I spoke about the new ADMs that were released in the beginning of November. With the ending of public health emergency, OPW released 4 ADMs on November 8th. And these ADMs are very important as they update previous guidance related to the provision of remote and home community-based services, community habilitation, and day hub. The new ADMs include community habilitation in residence requirements. This is ADM number 21002 revision, and it updates existing requirements for community habilitation services. Individuals living in certified residence may receive community habilitation residential services either inside the residence or outside the residence, depending on the needs of the individuals. The second ADM was covering remote delivery of HCBS services. This ADM is number 21-03. This ADM describes the requirements for using technology to remotely deliver the following services through the waiver, and it includes day hub, community habilitation, pre-vocational services, supported employment, pathway to employment, support broker, and respite services. So this is very helpful for the providers and for the who are delivering those services and who deliver those services. The third ADM was for community habilitation and residential services documentation requirements. That is ADM number 2308. The ADM outlines requirements about the community habilitation services. It includes information like where community habilitation may be delivered, how it's authorized, and how to document the service delivered for reimbursement. And the last one, ADM number 0601, group day habilitation service documentation. It replaces the ADM that was issued in 2006. The changes or updates reflect that on November 11, when COVID-19 Appendix K authority ended, day habilitation services can no longer be provided in IRAs or community residences of family care homes. People who require in-residence services may qualify for community habilitation residential. So all this information is available on our website. And with the expiration of public health emergency flexibilities related to day services, we have launched a couple of surveys, and we are working with the providers who are delivering day hub services to provide us data through the surveys so we can assess the unmet needs of the individuals. And this is what we are collecting in the information. So we have a better idea of what are the capacities and how many people are waiting for these services. And we're also working with the CCOs, and care managers will receive training on the data entry requirements, and then we'll have time to submit that information through choices. I want to mention that on November 27, OPWDD sent out April 1st 4% COLA certification survey to the provider. So that information is due. And that is due back to OPWDD. And my next topic is using the projects that we're working on, using the RPA funds. I think I mentioned in my last meetings that OPWDD is partnering with Cuny to develop micro-credential programs across the state. Numerous colleges expressed their interest in participating, and currently we have 13 schools in New York State under contract with OPWDD that offer a DSP micro-credential courses. And in addition to current 13 school, OPWDD is working with additional 7 schools around the state to expand these courses on campuses. We are launching a statewide marketing recruitment campaign for direct support profession that we hope that will benefit both state and voluntary agency recruitment efforts. And through a request for proposals earlier this year, we have selected vibrant brands to develop and launch a statewide marketing campaign to elevate and grow the direct support workforce and careers in this field. And vibrant brands working with a diverse group of advisors, which are made from self-advocates, nonprofit agency representatives, family members, and OPWDD staff to develop the campaign. And we had the first meeting that we had on December 4th. And the campaign and accompanying website is expected to launch in March, at the end of March. And lastly, I will mention that I think, Brian, you covered that Guidehouse. This is the nonprofit organization that was selected to evaluate the managed care. They recently issued a survey, and the survey is available through December. As they are trying to gather the feedback, and they are trying to assess feelings, attitudes, and perspectives of the individuals who are receiving these services, and on topic of managed care and systematic issues generally. So please, if you have time, and go ahead and submit the survey. It's available on our website at Managed Care Survey at OPWDD NewYork.gov. And I think that's it from me for today.
Nina, just real quick regarding Vibrant, we work with them at my agency. So I actually have had conversations with Rick and invited him to come to the council as well to do a presentation on what they're doing at some point when they have more details, and I know when the project's underway. So just so you guys are aware, but they are very well aware of our field and work with a lot of agencies in the OPW world. So I think that was a great choice.
Thank you. That's exciting. So more to come.
Rochelle, you have a question for Nina?
I do. Yeah. Good morning, Nina.
Good morning.
Thank you for the report. I'm happy to hear that OPWDD is doing a survey about day services, because we do know that there are many, many individuals who have no services or who do not have adequate services. And I believe that your survey will try to capture some of the reasons from the provider side for that, such as lack of staff leading to reduced occupancy or program closures. I was wondering if you're also trying to determine from individual and family perspective some reasons that people are reluctant to return to the programs as they currently are, such as excessively long transportation times, lack of robust programming within the programs that are open at times. So will your survey actually attempt to address those issues that are leading to unmet needs?
Well, I do hear the concerns, and I think we have that feedback from the other agencies as well. I do not know what exactly goes into the surveys or what questions the providers need to answer, but we're also working with the care managers, right? And we will be collecting data from them as well. But we all understand that things with the ending of PHE, right? We are not going back to normal as we had as pre-COVID times, right? And that's why those ADMs, 4 ADMs that I covered, they speak about different options available for the individuals who cannot attend DHAP services.
Just as a follow-up to that, Nina, a couple of things. One is strongly encourage OPW to consider doing some outreach directly to the individuals and families who are not returning to their day programs to discuss their perceptions of the issues. It's one thing to have other people interpret it for them. It's another thing to speak and collect data directly from them. And the second thing is, are you making any distinctions between site-based and without wall programs, and how people are reacting to changes in those programs as well?
Well, I'm not sure if you fully understand the question, but programs without walls, it's in community. They are supposed to be for the individuals who can be in the community and do not. And programs they have in rehabilitation certified sites are for individuals who require more restrictive settings, right? And again, the ADMs that I mentioned, they talk about the changes and updates on how these services can be delivered.
No, it's more along the lines, Nina, of certain programs that were without walls. Some of them are becoming site-based because of staffing or other issues. And I'm just wondering if your survey would be addressing that. You may not have the answer today, but I would like to raise that as a concern.
All right. Sounds good.
If I can just jump in, I know we have a couple hands up, but we completed a survey at my agency at Heaven's Hands, so I can actually just tell you the questions that are on it, if that would help.
Mm-hmm.
I don't know if that's exactly what you're looking for, Rochelle, but the first thing it really asks for is the individual receiving full-time services, and if not, what are they receiving? And they give us a breakdown. So we have to select what that is, and they break it down into half days all the way up to 5 full days. Is the level of service they're receiving now the same as it was at the closure date on March 18, 2020? And OPW provided agencies with data to be able to compare now versus then. Was the decrease in service agreed upon by the person in their circle of support and their circle of support? And it's yes or no. And if you hit no, then it opens up additional questions such as, was a due process letter sent? What was the date of the due process letter? Then it asks, is the agency actively planning for individuals to return to pre-pandemic service, although not currently able? Specify the primary reason the individual has not returned to the service level prior to the closure. And is there any additional reasons? Is there an additional reason? Please specify the secondary reason the individual has not returned to the service level prior to the pandemic closure. But if they are attending, then really it's only 2 or 3 questions you're answering. Are they attending? How much are they attending compared to before? And then it just goes on to the next person.
I would thank you, Brian. That's helpful. I would just say, does it distinguish between site-based and without walls?
So it's broken down program by program.
Mm-hmm.
So for example, at Heaven's Hands, we have 4 with walls programs, and I had to click in each code and choices to select that specific program. So maybe Nina can answer. I'm not sure if it's done the same way for without walls, but for the with walls, it was site by site, not
Right.
just by agency and individuals. Like you had to go in to the specific program code and then select those individuals in that code to answer the questions for.
That would cover uncertified day hab programs without walls as well. Last year, OPWDD worked with with agencies across the state to update the data we have in choices of individuals who are those who are receiving services in certified DHABs and programs without walls. So we have that distinction now. We have that data.
All right. Next question. I see Deborah has her hand up.
Yes. Nina, this is thank you, Brian. This is the first question. It's reference with the day have without walls. Have you put in some kind of question in there that the problem a lot of families have is that you have they get out very early and there's many times there's actual childcare because if the family can't get a respite worker, so like the program ends around 2:15. Next thing you know, the kids may be home by 2:30, 3 o'clock, and the parent is working and the child's not capable of staying home. The second, that with the ADM reference with reimbursement, I'm glad that that between the advocacy of the statewide as well as the DDAC's medical committee and others, we were able to cut down that you don't need for most items, you don't need a medical note from a doctor for justification. But those are the 2 issues that are really bothering a lot of the families. We just need to also work with the care managers to get them to fill the ADM, the life plans out. But have you gotten a complaints from families who say the day is so short that by the time the child goes, they're back? So I hope they can address this because it's very rough they need respite care and they can't always get it.
Right. Well, Deborah, as you mentioned to yourself, families should be working with the care managers, right? Children who are in school and families who are looking to receive respite services, we have some restrictions. So if the child is in school, they cannot receive respite services. But again, it's depending on a case by case basis.
I'm talking about adult day hab. I didn't talk about school. I'm only talking about the adult day hab. The kids can stay in a school program a lot longer during the day if they're in a D75 school that happens to have an after-school program. I'm talking about adult day services. These children, I've seen the individuals coming home very early and the respite or the parent is working and they can't figure out how to get back home in time to get their child who's over 21. That's the only area I'm talking about. I know about the under 18 school.
It would be helpful. Yep. Would be helpful if we have some specifics around the request so we can look into this.
But why does the day have been so early during the day? It's earlier than what they do in
3
school.
p.m. It's 6 hours. It's 6 hours, and there's also options. Some providers deliver supplemental day hab services, which is after 3 o'clock.
Well, let's try to work with them because there's a major issue. That's also why families may be keeping their children at a day hab. So I hope we can check on that because that's a serious issue. Okay, thank you.
All right. Next hand up I see is Carlene.
Thank you, Brian. Thank you for having me. First, I see some familiar faces, but some unfamiliar. So Nina, this question is for you. Speaking purely as a parent, I want to echo what others had said here this morning with the need for OPWDD to extend their questions to those who are served. That is the individuals and the families who are in the day hab programs, specifically post-COVID. From personal experience with the program that my son attends in Brooklyn and in other programs which we have visited as alternatives for him and which we know about, there seems to me to be some blurring of the lines between what is without walls and what is with walls. And as I understand it, the waiver does not have a clear distinction. Neither does OPW have any regulatory or ADM definitions of what are the contours of these programs. This gives providers some flexibility. Some of it is needed, but when you're on the receiving side, you sort of scratch your head, especially when I agree with your classification that site-based is deemed to be more restrictive. So I would firmly encourage OPW to reach out to individuals, to supports, to families, to try to get a full picture on what's going on in these day programs now. And I have my hand up to volunteer to assist in anything, any committees on that level, to gather information, to be helpful. And thank you.
Thank you, Caroline. As the DHAP surveys will be analyzing the results once the survey is closed. And as Brian mentioned, it would be very helpful that you submit your feedback, your comments for the managed care survey and express your concerns through those platforms that are currently offered. That would be very helpful.
And I see one more hand up for you, Nina. Doris?
Morning, thank you. This question may have been answered. It's for Brian and Nina. I want to just understand something. This survey is answered by whom? The director of the DayHab program is answering it, the staff, or is it given to the families, the parents, the guardians to answer for the member of the DayHab? I'm not clear who's actually filling out the survey or who's eligible to fill out the survey.
You're talking about the DayHab survey or the managed care?
The DayHab survey. Managed care, I know, is for everyone. Yeah. Providers, families. That's everyone. Yeah.
Right.
Maybe you said this, I apologize.
No.
I was thinking because Brian, you were saying you put the survey in the chat, thank you. But I wasn't sure who is actually completing it.
That would be the providers through choices. Those
providers.
Yes, providers. And also it would be another survey for the care managers. They will be also submitting their data through choices.
I see. Okay, thank you.
All right. I don't see any other questions for you, Nina. So thank you so much for your updates this morning and for answering all the questions after.
Thank you.
Brian, if I could just jump in here on the day survey. The one thing that has to be acknowledged is that, with wall programs, the participants spend a lot of time outside those walls, and it depends on the needs of those individuals. And the programs are geared towards the people they're serving. So somehow we have to break down these walls and acknowledge that a with walls program is not people sitting inside those walls the entire day. They spend a lot of time outside. And without walls, a lot of those agencies, those providers, and those individuals need like a home base to go to, especially if you have weather like today. So it's just something I think we got to clarify, somewhere at some point. But when people talk about with walls, generally it's more restrictive, but you have a lot of time outside those walls, working in the neighborhoods and the community.
Yeah, I think one of the concerns, Richard, and why this is coming up today and has come up since the return from COVID is the loss of, for the with walls programs, the loss of so many job sites and volunteer sites and community access points. And so many more people are now stuck within the walls because there's less places that people are allowing us to go. And that's coming from a day hab provider where our guys used to be out all day, every day. And there's just so, like, it was a lot of senior centers and things like that. And it's just too risky for those places to allow us back after the pandemic. They've changed a lot of their rules. So it's been a fight for us to get back into the community and have the same access for our people that we had before. But you're right, there is a big difference, but I think they are seeing more people staying within the walls now just because of the road bumps we're hitting. Mary, you have a question or a comment?
I do, just not on what Richard just said, but I wanted to ask Nina, what is the requirement for the hours of day program? Because you just said 6 hours, but my son is not in his program for 6 hours.
Well, it depends probably on the, it depends on what services and he's approved for. Day services are up to 6 hours, right? Depending on the need or depending on what was discussed with the care manager and how, and what care manager requested from OPWDD and also supplemental.
No, his day program, the hours of operation are not 6 hours yet.
Mm-hmm.
So that's what I'm asking you. You said 6. I'm asking what is an agency required to keep it open, or what? You said 6, like it's back to normal, but ours is not back.
Not every agency, right? Not you're correct, Mary. Not every agency is
Operating at 6
their
hours.
door back to normal, right?
Okay. I just thought you made it standard that they're,
I mean, right. I was talking from the billing perspective.
Okay, thank you.
All right, if there's no other questions, again, thank you, Nina. And we can turn it over back to Richard now for the IAC update.
Okay, just one last comment on the day side. There have been comments from some boroughs that if they have people going back to day program or people enrolling for the first time, it's much easier to get the final approval for someone going to a without walls program versus with walls. What's been stated, and we have to look at the data. If you're applying for a without walls program, you can get approved within a week or two. With walls programs, they're saying it's taking 4 to 6 weeks. Or actually, I'm sorry, 4 to 6 months. So, but that's for another day. But it's something to be aware of if you're trying to get someone enrolled. Is it taking longer to get into a with walls program, even if it's open and even if it has vacancies? Okay. Hi, everybody, and welcome. Happy holidays, Merry Christmas, and hopefully we get some work done this week. We know we won't get anything done next week, but I'll be working. So we're coming up on the budget year. The state of the state will, the governor will be issuing that on January 9th. And they're expecting this year for her to the governor release her budget on January 16th. Sometimes in past years, it's come out on the same day as the state of the state, but this time on the 16th. And that's why IAC, together with the other associations across the state, are urging people to send letters. And there's a template letter that was created and we've sent out to everyone. Hopefully the councils have sent out template letter for families to give to their legislator to then send to the governor to urge, cost of living increase of 3.2% and $4,000 wage enhancement for DSPs. First, the reason we're trying to get it out now is so it might get into the executive budget and not have to wait till after that. And we're much harder to get it into the budget. So, Brian, I assume you've sent that letter out. Yeah, it's a template letter. And I don't know how to put it into the chat, but maybe we can just send it out again. For again, families and others.
I can add it to the chat for you.
Okay. Again, to get to the legislator, who the ask is to get it to the governor. Create that pressure, and I've been told that the governor is getting a lot of letters on this, so let's keep our fingers crossed. The other thing going on this year with lobbying is that the larger association called NIDA, New York Disability Advocates, IAC is a member of that, state CP, NYSARC, New York Alliance, Western New York, and so forth. The goal this year is to be in Albany in the legislators' offices as much as possible. So they've spread out the lobbying days over February and into March. So on February 12th, there's going to be another big rally in Albany, probably, I guess, in the War Room. I'm not sure. But that's also the ARC and the New York Alliance lobbying days. That's going to be a very crowded day. Hudson Valley is going to be February 26th. March 1st of the 5-borough breakfast, as Brian mentioned. New York City Lobbying Day in Albany is going to be March 4th. We're going to try to get that organized. One thing I'll just announce, for those who usually go to the New York City Lobby Days, we don't have a block of hotel rooms this year. People are on their own, but we're told by the Hilton that they will give us a reduced price. We'll get that information out shortly. And then the other days, March 11th is Westchester, March 18th is Long Island, March 25th is another NIDA rally. Again, we'll get that out there, but it's to be present in Albany as much as possible. This year, we're also focusing, at least IAC is focusing on getting family members and participants, all the constituents, to come to Albany or to the local legislative office. The focus is there for families to go into a legislator and say, I live in your neighborhood. Here's what I'm supporting, and I'm a voter. And it's always been very effective to get family members talking directly to a legislator. Especially effective when you're walking down the aisle of the supermarket and there's that legislator. And they're reminded of, oh, there's Mary who came to see me in Albany, or came to my office. She's going to ask me, how's the budget going? I better pay attention to her. So that's like a kind of new emphasis here, or additional emphasis. The other issue, I'm not sure how we're going to work this in, and this kind of goes back to Nina's mention of there's going to be an effort, public relations effort to attract DSPs. And of course, we have that conflict between what the voluntary agencies can pay its DSPs versus what the state staff get paid. We won't make a big point of that in certain venues, but we will be making it with the governor's office. The state staff get paid a lot more and can attract a lot more people more easily than the voluntary agencies. In the education world, right now in preschools are a major concern, because last year there was created with COVID funds an enhanced service day. The day was longer. These funds were used to improve teachers' wages. Very successful. But now those COVID funds have dried up, and guess what? The city forgot to identify, come up with the funds to replace those COVID funds. So there's a major effort going on. There's a coalition of advocates and providers. It's called the Emergency Coalition to Save Education Programs. Again, this is for primarily for preschool. Chris Trieber from IAC is on that group. They've been talking to city council people, to the mayor's office, the city budget office, trying to identify how we can save and come up with funding for our preschool programs. This is on top of the mayor announcing a 5% budget cut, which includes education. So we're into a real struggle this year. Keeping people busy. Finally, just if people are looking for training on special topics, IAC's website, that's iacny.org. If you go to the events link, it lists not only the trainings, but the IAC committee meetings. The committee meetings are only open to IAC members, but the trainings are open to all. For family members, get special consideration. You would just call Jenny at IAC. You can email her. It's JENNIE@IACNY.org. So if there's a training you as a family member are interested in, email Jenny and see what special consideration can be made. That's all made possible by a very generous family member who you all know, but I won't identify. So with that, I guess that's my report, and we look forward to seeing you all in Albany and around the district of your legislature. Questions?
Thank you, Richard. Rochelle, you have a question?
Yeah, me again. Hi, Richard.
No.
It's actually just more of a comment. Just last week, the Legislative Black, Puerto Rican, Hispanic, and Asian Caucus came out with their people's budget for the year and has included our issues of the COLA and the wage enhancement and even wage parity with government DSPs as part of their platform. And this is really significant. It's the first time for us, I believe. And we need to make sure that we thank them as a group.
It is great. And thanks for bringing that up. I meant to do that, but I forgot. So yeah, that's a major accomplishment. And I think it gives us all more hope that these increases will get into the budget, and we'll work together with them. Thank you.
Richard, you do have a question in the chat. What happens when the family member can't afford the fees for the trainings at IAC?
Oh, that's when you send an email to Jenny, JENNIE @IACNY.org. I'll put that in there because we do have a scholarship fund. It's not for every training, but those that would be helpful to families or individuals.
And I believe I had shared an email on your behalf. There was a recent training. I don't remember what it was for, but Jenny had told me that there was a donation made and families could attend for free because of the donation that was received on your behalf.
Right. That was the advocacy training. I'm blanking on his name, our old friend.
Gary.
He'll come to me later.
Gary
Goldman. Did you attend, Ellie?
That was me.
Yeah. Okay. Yeah, Gary's been
Mary, you
around.
have your hand up?
He and I used to do trainings together.
Yeah. I did. Richard, do you have, is there a website where I can see all the rally dates you just mentioned? Is it on your website or? I got the first ones, but I missed the early ones.
As the people at OPW always say, that's a great question, Mary. We'll get it up there.
I
Sent something out this morning.
Oh, okay. Thanks.
I forwarded it to you all.
Okay. I didn't look at email. Thanks.
You, Ellie?
Richard, I have a question. For the dates that you gave, I thought I had heard in a prior meeting that with all the increased meetings that it was going to be broken down by region.
Yeah. So, for example, New York City is going to be March 4th. The Albany region is February 12th, along with the ARC and the Alliance. February 26th is Hudson Valley. Westchester is March 11th. Long Island is March 18th. And there's others, like Western New York. I didn't write them down. The big question for our rallying effort in New York, for New York City, is a lot of our staff don't live in New York City. They live in Westchester or Long Island or whatever. So there'll be some discussions on which lobbying effort they want to go to, or they can go to all of them. We obviously need people from the districts who have services in that legislator's district, and that's the way we've always done. So now for a lobbying registration for New York City, we're going to be asking the lobbyist zip code. So we're still organizing that, but it's going to really gear up quickly. And by the first week of January, we hope to have everything out.
All right, there's a few more questions for you, Richard. Oh, Ellie, you just put your hand up.
My hand is always up. Richard, the lobbying is particularly, in person is particularly hard because of the staffing issues. I mean, we're in a circular thing. How do you get up there without, how do you get the people you support up there without staff? There's not enough staff to stay behind. It's a whole thing. I don't know what, maybe you have a bunch of empty chairs when up in the, I don't know, but it's a circular issue.
Yeah, it is. And the previous rally in the War Room was very well attended. I have a feeling a lot of those were from upstate agencies, and maybe they were Dayhab people making a Dayhab day of it. But you're right, Ellie. It's that might be a good idea. We could have some empty chairs with some kind of a sign on it, just reflecting that they wanted to be here but couldn't because they have to staff the program.
The ladies in Buffalo do that all the time when they invite legislators to their meetings and they don't show up.
Yeah.
Just saying, embarrassment helps. I will be quiet.
Okay. Another good idea, Ellie. Thank you.
The next hand I see is Deborah.
Hello, Richard. Richard, since I also broke my foot, now I use mobility device. I don't want to know if your buses are accessible. 2, every time I've been, when I did go years ago, but I was brought in by other groups, they always look at me, the legislators, at Debbie, why are you up here? Because I'd rather you come to my office in the actual district. So you and I or if he can't, the staff members, they give me more time down in the office, in their actual district office, as well as it's accessible because they make sure I can get there. And if it's not, they meet me somewhere where they can. And the other thing is that they give me a lot more time, and I don't just talk near lobby day. I'm with them all the time. But also I'll tell you, okay, we're not members of IAC, but we parents of the advisory council.
Yeah.
We don't get invited. We're ignored, and our feelings are hurt because you see, we have been advocating, and I never hear you say to us, "Thank you." I'm going to acknowledge Winnie has thanked me, and I will say Chris Trieber, but that hurts because you know what? We may not, because of different issues like mobility or even childcare, we still figure other ways to advocate. And I would like you to acknowledge us that we've helped. We do it because it's the right thing to do, because I want everybody to have services. So, please remember, people like myself, I can't take a chance if your bus isn't accessible. And then I get in the war room. I don't know if it's accessible. I'm not climbing stairs anymore. I don't want to fall
Deborah,
down.
one of the plans this year are to work with the councils to do the local visit lobbying. That's always been the plans this year. It was in the plans last year. So yeah, of course, if families can't make it up to Albany, and it is always helpful, even during the virtual visits last 2 years, it was very helpful to have a family member there. There was one mother from Manhattan who spoke about the early intervention issue last year, and she won over that legislator, and the early intervention bill almost made it through. And I think it was because of her. So no, we're very appreciative. And that, again, that's why this year, for the lobbying legislation for the main IAC, we're asking for zip codes so we can get people who live in that legislator's district to go to Albany, but also, go to the local office. Brian, we'll be in touch about organizing the districts, visits to the local district offices. No, that's been in the plan, and I thank you, Deborah, and thanks for reminding me the last meeting of the Family Council up in Albany. Any news from that you want to share?
Yes, sure. I'll do a quick share. Between my committee, chair of the ADM subcommittee for reimbursement, as well as the medical profession, we were able to get OPWDD to take off the medical justification for everything.
Oh, great. I
And
mean,
that was, that's because
the clinical justification, they
right,
call it.
clinical, but I had no problem taking, and I walked in with all their guidelines when they originally put it out, handed to a doctor that's known Christopher forever and has written those justifications. And he said he couldn't do it because there was no guidelines, and that's unbelievable for him to say that. And then I asked him, well, can you share this with your your professionals that you know? Not a problem. And then I know that there are medical committees, and they were on the same page as me. So to me, that's a very big deal, because there's not medical justification for everything because of what our kids do or need. The other thing is, we have asked them to be, the only issue we're having is for the care managers to have to fill in if the individual has a life plan. But I also brought up to everyone, please also let everyone know, not every family has care managers, and not everyone their parent can write it up with their using the paperwork and the stuff they have for the child. You don't have to have a care manager as long as the child's living at home with you. So we were able to get that, and we're very happy. We're happy that it's going, but we would like to see other things changed. It's a work in progress, and that's what I'll say. And I want to thank first off, to be honest, Albany Central was very receptive and heard us. At first they were a little, but then they realized what I was saying, and they were receptive. I also want, one thing I've been reiterating, and I appreciate also you can do this too, Richard. It wasn't, none of the local Family Support Reimbursement coordinators set up the new ADM for reimbursement, because I don't want to hear people being yelled at when that's not who set it up. If you understand what I'm saying, because you can't blame someone who had nothing to do with it. We knew it came out of Central. We realize it's going to be fixed and it's a repair, but we don't want to see our local DRO staff put down or attacked, because we need them, and it's not fair. They understand how to do it, and they've been willing to help. I've been doing the advocacy piece to bring back when they let me know of the information they need. But when it comes to helping the family fix, the coordinators are doing the best they can, and I appreciate that. So it's still a work in progress. So that you like my updates for now?
Yeah.
Good.
Very good. Good
And you
news.
please let me know too if you hear issues. You can email me. You can't get me, forward it to Christopher or Brian. I'll get it. Because I will answer back and I will check. But you see, it's a very important program that I hope will never get lost or closed.
Thank you.
Okay. You're welcome. Thank you.
All right, any other questions for Richard? All right, I don't see any. Thank you so much, Richard, for your update.
You're welcome.
And is there anyone here from New York City DOH? I don't believe so, but I want to just throw it out there in case. I still don't think they've assigned a new representative to come to the council meetings. All right, so then next up, we have our presenter. So I want to welcome Suzanne McDermott from the Cuny Steps 2 program. Take it away. If you need my help with the PowerPoint, please let me know.
Okay. Hi, everybody. My name is Suzanne McDermott. I hope you can all hear me. I'm a native New Yorker, but I've been out of New York. I've been back in New York for the last 3.5 years since the beginning of COVID. Previously, I spent a number of years in South Carolina, where a lot of this, the ideas for this project began. But let me start by saying that, you know, I have a daughter with intellectual disabilities. She's an adult. And so I've lived my life with that knowledge, and I've worked with really thousands of people with intellectual disability throughout the state of South Carolina. And one of the things that has always disturbed me is that I'm an epidemiologist, which means that I know how to conduct studies. And the highest level of research is a randomized clinical trial. And people with intellectual and developmental disabilities has systematically been excluded from clinical trials in the United States with the assumption that they couldn't provide truly informed consent. And I have spent my career lobbying against that, because we all know about circles of support, we know about guardianship, and we know that some people with intellectual disabilities certainly can provide support, their own informed consent. So this program that I'm going to talk about today is something that's funded by the National Institutes of Health. It is a randomized clinical trial, which, as I said, is the highest form of research. And it's restricted to people, young people with intellectual and developmental disabilities. I'm really excited that we got this grant. I've had other NIH grants in my career, but this is the first time I got it on the first try. And that's because families of individuals with intellectual and developmental disabilities have actually lobbied Congress, National Congress, and there is a fund set aside for families, for people with Down syndrome and other forms of intellectual disability that in part is funding this project. So it's funded by the National Institutes of Health. Generally, a small portion is funded by this special set aside to be sure that our population does get advantage to participate in research that is a breakthrough in our area. So this study is called STEPS 2, and it stands for Socialization to Enrich Participation and Support Sexuality for Young People with IDD. I'm Suzanne McDermott. My co-principal investigator is Heidi Jones. We're both professors at Cuny School of Public Health up in Harlem on 125th Street. I have a son who lives in Brooklyn, by the way. I have family members around the city. We have a large and wonderful team of people, and we're excited to be doing this program. So we're doing it because we know that people with IDD need to improve sexual and reproductive outcomes. We know there's a ton of programs out there to do that, but they are not evaluated by a randomized intervention trial. And like everything else in health and medicine, people don't want just to be told they can receive a treatment or take part in a program because somebody else thinks it's a good idea. We like to have evidence, and this is a real effort to provide that evidence. We don't want to take away from the pamphlets and other programs that are out there, but we want to test this one at the highest level. So it's a randomized trial, as I said, and we're only including 16 to 27-year-olds who live in New York State, anywhere in New York State. The age group was set aside by the National Institutes of Health. They felt it was really important to start at age 16 when people are merging into their transition years or in their transition years up till the age of 27. And we're including people with mild to moderate intellectual and developmental disabilities, people with diagnoses of all kinds of autism, intellectual disability, all kinds of specific conditions, cerebral palsy, spina bifida, all, anything that falls under that general category. The interesting part about a randomized clinical trial, and I'm sure you've all heard about this in drug trials, some people don't get the primary intervention, they get something else. And here we really wanted the something else to be something really good. So people are randomized with the roll of a dice into either the socialization and sex ed program, or they're randomized into the physical activity and nutrition program. And that's a program that I developed in South Carolina with funding from the Centers for Disease Control. So it too was a randomized clinical trial, and we know it works. So this, if the individual has a preference for one side or the other, we cannot honor that preference. That is true of every single clinical trial in the world. You get randomized. So I guarantee that both sides are fun and interesting, and we've gotten incredibly good participation in South Carolina. The socialization and sex ed program became a Medicaid fundable program there, but now we're doing it in New York. We're doing it for 16 to 27 years old people, men and women, males and females, boys and girls. As part of the program, the participants will be asked to participate in short surveys 4 different times. And each time they participate in a survey, they get a $25 Amazon gift card, which they can spend however they want. The curriculum on the reproductive health side is called Steps 2. It goes over 6 weeks. It's once a week for a one-on-one with a wonderful health educator on Zoom or any other platform that the person prefers, talking about wherever their starting point is. So if the individual is young, hasn't had zero sexual experience, we don't worry about condoms and birth control. We talk about socialization. There's a whole lot of information in our curriculum about consent and socialization and how to make friends and how to keep friends, about our bodies and how our bodies work. All of that has been done, and it's been tested in South Carolina. So we know that there is an improvement in knowledge. In South Carolina, we did not run a randomized clinical trial for the STEPS program. That's why we're now calling it STEPS 2 when it is a randomized clinical trial. But over 800 people participated in that evaluation study. And now we're raising the bar and saying, does it work when it's a randomized trial? We've updated the curriculum. We've pilot tested it with people who we call lived experience consultants. We hired 15 of those people at all levels of IDD who participated in every step of the way in developing the survey questions, in refining the curriculum, in having our health educators practice the curriculum. So our lived experience consultants are paid employees. They make $20 an hour. They don't work full time. It's just a few hours a month, but they have been instrumental in getting our project going. We also have an advisory board, primarily made up of physicians and health experts. We also have Jill Pettinger from OPWDD. We have Chris Griff, who is one of our, he is not a lived experience consultant, but he's part of our advisory council. So we meet regularly to talk about what's going on. And everybody who participates in the program receives one of the manuals for either arm of the study. The other half of the study is what we call Steps to Your Health, and that is also 6 weeks, once a week, also remote. But the difference between the two arms is one arm, you meet one-on-one for the reproductive and sexuality arm. Here you meet in small groups. So our groups are from 3 to 6 people. They talk a lot about food choices. They do physical activities on Zoom together. There are stress reduction exercises that are done every time. And again, as I said before, this was done in a clinical trial setting funded by the Centers for Disease Control. So we're quite confident that it works. And again, the individuals get the $100 for answering surveys, they get the participant manual, and they get the fun of being in a small group. These are our 3 health educators who work one-on-one and work in the small groups in the Steps to Your Health side. Jordan, Ariel, and Abigail are wonderful people who have had a lot of life experience with people with intellectual and developmental disabilities. And we started actually recruiting and implementing the program back in October. And I can't tell you how happy our participants are with their teachers, their health educators. As I said, we have had 15 lived experience consultants who have given us all kinds of positive feedback about what they learned, how they learned it, whether it was a fun activity to participate in, and also all kinds of information that we've integrated into the program. So as I said, we started back in October recruiting. In November, we had our first group of participants. We have 2 active groups going right this minute. We're currently desperately looking for some more enrollees for January. We have 2 groups starting in January, and we're really eager to fill those 2 groups. This is going to be going on for the next 2.5 years. And we think once we fill the January groups, the ball will have begun to roll. We get positive feedback from the people who participated. They tell other people. We've been in touch with, through OPWD, Jill Pettinger sent out a letter to all the CCOs and all the direct service providers. So we're expecting enrollment to continue. We're recruiting 860 people, but we are having a little bit of trouble filling the January classes because right now people aren't dying to talk to us about the project. So if you know of someone, this slide shows how to get in touch with us, and we really hope to get some enrollees from the Brooklyn DD Council. And, I have been a member of the DD Council most of my adult life, not here, but in South Carolina. I know how this works, and if you can get the word out, we really appreciate it. So if anybody has any questions or any thoughts, please let me know. The phone, the addresses and email addresses are here. So please feel free to ask any questions.
Thank you so much, Suzanne. And for anyone that is on our mailing list or checks our website, we have posted their flyers and shared it out, and I'll continue to do so. So if anyone needs new copies of that, please let me know. I see we do have a hand up, Debbie.
Hi, Suzanne. I have a message from Christopher for you. He says he's very glad to be working with you on this. I'm very glad because I like to treat him like I treat him because he is an adult. He may have a developmental disability, but he's an adult and stuff. And I have to say, he tells me sometimes, but I know he enjoys being on it. He likes to express his thoughts and feelings. The only thing I say is too bad he was younger, then he could have done the other part to help you.
Right.
But, but he can't right now. He can't, he would have been on, but he left the charger home. So he's at 2 Broadway. So he asked me to give you the message.
Thank you.
So
Okay.
he is supporting, and it's great. You're counseling and what you've been doing. Keep up the great work.
Thank you.
You're welcome.
Are there any other questions for Suzanne?
And hopefully this will be the first of many things we're doing. This is what my academic career is all about. And, research is really important so that we can turn things into Medicaid funded programs. We need the evidence from things like clinical trials in order to do that. So we're excited about the future as well.
Yeah, it sounds like a great program. Hopefully, as the word continues to get out, you'll find more people interested in being involved, and we'll continue to help you spread the word. And please feel free. I know you attend most of our monthly meetings. maybe look at some of the like the transition committee, because that hits that age group as well.
Mhm.
And I can connect you, if you haven't already, with the co-chairs of that committee
Yeah.
and maybe the employment committee to help get the word out there as well.
Right. And let me just say, we're also willing to run around the city. I go to Uptown Hoops. We go to almost every single Special Olympics event, because meeting people face to face really is how we get most of the people to participate. We go to the DD fairs, we go to the public, the District 75 open houses. So, we're out there running around the city trying to get people to participate. And if you know of places we should go, send me an email and I'm happy to figure out if we can.
All right, great. Thank you so much for your presentation. I don't see any other questions at this time,
Sure.
but if any come over to me through email or through our website, I'll make sure to pass them on to you.
Thanks.
Thank you so much.
I don't even know how to end the share, so you can do that if you can. It's kind of, I tried pressing the button and didn't seem to care. There we
There we
go.
go.
Got it.
All right, so next up on our agenda, committee updates. So do we have any committee co-chairs that want to talk about what's going on within their committees from the Brooklyn Council?
Yes, it's Deborah. If you don't mind, can I do my full reports? Because the issue I have this morning, he's coming up in the 5 minutes.
Okay, so you're gonna do the family support update as well, and the MTA?
Yes, yes.
Okay, go ahead.
Okay, hello, everybody. I'm going to first do Deborah Greif, Chair of the Advisory. The Advisory Council, it's today's meeting. We did join with because of the holidays. And I know everybody's been asking us questions about our resource fairs. Now, the one that we're doing with the Development Disability Transportation Resource Fair, January 12th, which is going to be from 11 to 1 at the Brooklyn Heights Library Cabin Plaza. We're full, but anybody can come. When I mean full, to have a table with your info, but you still can bring your information, but participate, because we're trying to see that people can get their MTA reduced fare, an Omni card, the New York City Transit Museum there, and Accessorize will be there. So any of this information you need will be on our website, and you can call. The number is 718-264-5084. If you need interpretation, you're going to have to contact Inclusive Service Events at brooklynlibrary.org. Everything is going to be on the website. Now, the big one we're having, our big Developmental Disability Resource Fair, Monday, January 29th, and from 11 to 1 p.m. at the New Trick Library. And we're going to have the Brooklyn Family Support Service Advisory Council, the Brooklyn DD Council, OPWDD, Center for the Independent Living of New York, MTA Reduced Fare, local agencies, and more. If anybody wants to participate in our next series of fairs, please email the Advisory Council at bfssac@yahoo.com. We will then put you on the list. And once if we see openings or someone has declined, we will contact you. But please get it to us by December 30th. We'd appreciate it. Now, I am doing an update for Christopher Greif, he's right now at 2 Broadway. Kept hearing me say he left his phone is like practically gone. So I'm going to just do a quick update. Everyone is concerned about the congesting pricing. Now, of course, if you notice, the press has not put in about the discounts and exempts, but it is on the it's on the Advisory Council's website. Now, if you have a license plate on your car that has the handicap symbol, you will be either getting free or for reduced fare. And they do have a program for people who have to use their card, for low-income drivers. The other thing also, we want you also to know that we're trying to make sure that we know that the vans that take our individuals back and forth to medical appointments or doctor or to Delta day habs, they most likely they are going to be going on they'll be discounted too. But if you only have the placard hanging in the window, at the moment that's not counting. But I will tell you, MTA, even way before it became public knowledge, the lady, the princess, made sure that information about the congesting pricing to be geared toward people with disabilities would be included. They're still working it out. I know that there's going to be a lot of other people need to discuss things, but they are establishing exempts, and that includes us as well as city vehicles, accessorized, any kind of specialized snow removal, but they are still working on it, and they're not ignoring the disability groups at all. They're working on it, but everyone only talks about everybody else but the people with disabilities. So when Christopher gets more updated information, we will share it with Brian's council as well as ours, and we'll keep you all informed. I'm doing this really quick. We have, as you know, I'm the co-chair of the Provider Family Information Committee with Rosal. We had our meeting on Wednesday, December 13th, and Yvonne Rodriguez did a great presentation on her healthcare organization that deals with families who have children with developmental disabilities. Next month, on January, and we now are going to be doing our meetings on Wednesday only from 10 to 11. We will be having in January 10th ACA. February 14th should be Tri-County, and I will get the update of who will be a speaker on March 13th. If you need this information, all will be on the DD Council's website as well as the Advisory Council's website. So we will keep everybody informed. Also, I apologize. PHP will also be doing a presentation. I believe it's not in January or February, maybe up to March. We will make sure everything is listed on. Rose asked me to wish everybody happy holidays, and I wish everybody health and happy holidays. Does anybody have any questions for me?
So I don't see any questions in the chat or any hands raised for you, Deborah, but thank you for your updates.
You're welcome, and thank you for accommodating. I have to run for a minute. I'll still be on because I want the full recording to go through, but I'm muting, okay?
All right, thank you. Any other committee updates from the council? No? Anyone want to plug their meetings from the council? Everyone's being shy. All right. Okay. Who was that?
That was me. Just make a quick announcement, although everything is not set yet. Introduction, my name is Maria Willis, and I'm one of the co-chairs for the Legislative Committee with Lucina Clark. And our plan is to have a Legislative Committee meetings on the second Wednesday of the month from 11 a.m. to 12 noon. And that will be on January 10th. We will be sending Brian the platform. I believe it will be Zoom, but Brian will be sending you that information so it could be posted. Thank you.
Thank you, Maria.
Welcome.
And I believe I had mentioned in the beginning of the meeting, the employment committee will be starting up in January as well. And I believe their first meeting is Tuesday, January 9th from 3 p.m. to 4 p.m. And again, you can find that on our website with the links. Zoom link is not there yet, but the date on the calendar is there. As soon as we get the Zoom links, they will get posted. Okay, I believe that is it for committee updates. So now we have time for announcements. So if anyone would like to make an announcement, You can, I know, please put it in the chat as well, but also you can make it now. Go ahead, Doris.
Good morning. Good morning, everyone. My name is Doris Kahn. I am the outreach coordinator for New York State Institute on Disability. We have openings for evaluations for the purpose of obtaining OPWDD eligibility. Individuals have to have, they do not have Medicaid, and they have to live at home within the 5 boroughs. You can contact Elizabeth Sunshine at 917-699-0578. NYSID also provides crisis management services headed by Juliet Hawkins for individuals who live at home in the Bronx, Brooklyn, and Queens. And you can contact Juliet at 917-524-4856. We also have openings for reimbursement, and that is for individuals who live within the 5 boroughs. And you can contact Jackie Tripodi at 929-202-1115. NYSID has tickets for various venues in the city for individuals and their families. Requirement is that you live in the Bronx, Brooklyn, Queens, and Staten Island, and you live at home. And you have, of course, OPWDD eligibility. You can contact Sarah Alton for a list of venues that are available and application. Her phone number is 718-494-6457. NYSID provides also free transportation for anyone who's attending our venues, or if for medical appointments. And if the individual lives within Brooklyn, Bronx, and Staten Island, you can have free transportation if you live in Queens, if you're going to one of the venues that we provide you tickets for. And for transportation, you can contact John O'Grady at 917-747-9424. And on behalf of everyone at NYSID, I want to wish everybody a happy holiday and a healthy, happy new year. Thank you.
Thank you, Doris. Jay.
Yeah, hi, Jay Kleinman from LifeSpire. We have in Brooklyn, we have referral and linkage through our crisis program. And in Queens and Manhattan, we have behavior management, parent training. So for any of those services, you can just give me a call at 646-338-5632. And I'll also put my email and phone number in the chat. Thanks.
Thank you, Jay. I don't see any other hands up. I do want to just point out I had shared a flyer in the chat. I believe they're going to be presenting in our February meeting, but Autistic Adults NYC, I believe they're a fairly new organization. So you'll see the flyer in the chat. They're holding an event for their Pause group on February 2nd. And this is a new social club for non-speaking, intellectually disabled and or high support needs autistic adults in the New York City area. So I believe their first event is going to be based in Brooklyn. And I thought it was good to share because it is focused on a group that's not usually the focus. So it's really nice to see that they're focusing on the nonverbal or non-speaking individuals that require more support. And they're starting a support group for that. And again, Sarah is the point person. I believe she'll be doing a presentation for us in February. Any other announcements from any agencies, any elected officials on the line? No? Okay. So I will just end it with reminding everyone our next meeting is January. Oh, is there someone that wants to say something?
Yes, I did. I wanted to make it an announcement for Heaven's Hands. We have vacancies for our day rehabilitation programs in Brooklyn with Walls. It's located in Sunset Park, and we have one also in Brownsville. We are also accepting applications for our community rehabilitation program in Brooklyn and Queens. If you want any more information, you could email at intake@hhcsny.org. Thank you.
And to and from transportation is included.
That's
Thank you, Kim.
correct.
All right, so I don't see any other hands up. I don't think I missed anything in the chat. So just a reminder, January 22nd is our next monthly meeting. We're gonna have a presentation from Paula Martinez Boone from the New York Public Lawyers, and she'll be presenting, her topic will be on future planning. And I know usually when she does presentations, it's very helpful to families, very beneficial. So please pass the word out to anyone you know that this would benefit. And if no one else has anything, just want to wish everyone a very happy holiday, happy new year. And we will see you guys in 2024.
Happy New Year, happy holidays.
Happy holidays,
Bye,
happy
all.
New Year, everyone. Be
Happy
well. Stay safe
holidays.
out there.
Safe.
Hope
Stay dry.
2024 is a better year.
Yes.